Have you ever wondered how bird flu can infect humans? Bird flu, or avian influenza as it's scientifically known, is a viral infection that primarily affects birds. This includes a diverse range of birds from domestic poultry to wild birds. Interestingly, certain strains of this virus have the potential to infect humans. Notably, the H5N1, H7N9, and H9N2 strains have been known to cross the species barrier. This doesn't happen randomly though, it's a result of the virus's ability to mutate and adapt. These changes in the virus can, under certain conditions, make it possible for it to infect humans. It's a fascinating, if somewhat unsettling example of how interconnected the world of nature really is. So, it's not just about birds getting sick, it's about understanding how diseases cross barriers and how we, as humans, can be affected. These viruses can mutate and adapt, allowing them to occasionally cross the species barrier and infect humans. Now let's delve into how humans can contract bird flu. The primary mode of transmission is through direct contact. This can occur when humans handle infected birds, poultry, or their droppings, exposing them to the virus. Another way the virus can be transmitted is through inhalation. This typically happens during the slaughter or processing of infected birds, where aerosolized virus particles can be inhaled. Additionally, contact with contaminated surfaces or objects can also facilitate transmission. This happens when a person touches a contaminated surface and then touches their mouth, nose, or eyes. Even though it's quite rare, bird flu can also spread from one infected person to another. However, this is not a common occurrence. Despite its rarity, it's crucial to monitor for human infection and person-to-person spread. This is because the virus has the potential to change, and if it does, it could spread easily among people. Certain factors increase the risk of human infection with bird flu. Occupational exposure is a major one. People working in poultry farms, live bird markets, or involved in poultry culling are at a higher risk. They are constantly in close contact with birds, which increases their chances of getting infected. Then there's the risk factor of living in close proximity to infected birds or environments contaminated with the virus. If you live near poultry farms or places where birds congregate, your risk of exposure to the virus escalates. And let's not forget travel. Visiting regions with outbreaks of avian influenza can pose a significant risk of exposure. If you're traveling to a region known for bird flu outbreaks, you need to be extra careful. Understanding these risk factors can help in taking preventive measures. Knowledge is power, and in this case, it could be the key to keeping you safe from bird flu. Prevention is better than cure, especially when it comes to infectious diseases like bird flu. Implementing prevention strategies is key to reducing the risk of transmission. One of the first steps is to avoid contact with sick or dead birds, particularly in areas experiencing bird flu outbreaks. But it's not just about avoidance, it's also about practicing good hygiene. Always remember to wash your hands thoroughly with soap and water after handling birds or poultry products, or even after visiting live bird markets. Another important strategy is to cook food properly. Heat kills the virus, so ensuring that poultry and eggs are thoroughly cooked is crucial. For those who work with birds, using appropriate personal protective equipment is vital. This includes masks, gloves, and goggles. Lastly, in some regions, vaccination of poultry populations might be recommended. This can help control the spread of avian influenza and reduce the risk of human infection. Early detection and reporting of bird flu cases are crucial in controlling the spread of the disease. When an outbreak of avian influenza is suspected in birds, it's vital to swiftly report these cases to health authorities. This allows for prompt investigation and the implementation of containment measures, helping to prevent the virus from reaching humans. If a human case is suspected, early medical intervention is key. It's important to understand that bird flu cannot be diagnosed based on clinical signs and symptoms alone. Laboratory testing is necessary for an accurate diagnosis. Typically, a swab is collected from the upper respiratory tract of the affected person during the early days of illness. This not only confirms the presence of the virus but also identifies the specific strain, which can guide treatment and containment strategies. Remember, early medical intervention for suspected human cases can improve outcomes and prevent further spread. With bird flu posing a significant threat to both poultry and humans, public health measures are essential to curtail the spread of the disease. Firstly, practicing safe food handling can greatly reduce the risk. Always ensure that poultry meat is thoroughly cooked to an internal temperature that effectively inactivates viruses, typically above 165°F or 74°C. In addition, avoid direct contact with raw poultry fluids. Secondly, biosecurity measures on poultry farms are crucial. Farms should restrict access, use footbaths, and properly dispose of bird carcasses to prevent the introduction of the virus into their flocks. Thirdly, maintaining general hygiene practices, such as frequent hand washing and refraining from touching your face with unwashed hands, can help prevent the spread of any respiratory virus, including bird flu. Lastly, staying informed about the latest developments is key. For the most current information on bird flu strains and recommendations, refer to reliable sources like the Centers for Disease Control and Prevention (CDC) website. Remember, the combined efforts of individuals, communities, and governments are necessary to effectively manage and control the spread of bird flu. Let's all do our part in keeping our environment safe and healthy. Before we wrap up, we want to remind you that you're not alone in this fight against bird flu and other health challenges. We're all in this together. And by subscribing to our channel, Medicine Health 360, you become an integral part of this health-conscious community. Your support allows us to continue providing you with the latest and most essential medical and health knowledge in an easily digestible format. So, if you found this video helpful, give it a thumbs up to show your support. Remember, every thumbs up encourages us to continue creating high-quality content that can help everyone lead healthier, safer lives. And don't forget to hit the subscribe button and the notification bell so you won't miss out on any of our upcoming videos. We value your input and feedback, so please feel free to share your thoughts or ask any questions in the comments section below. Together, we can help each other stay informed, vigilant, and healthy. Thank you for watching, and remember, knowledge is the first step towards better health and a better life.